Thank you all for joining us today. We will get started in just a few minutes and allow everyone a chance to log in. Thank you all for joining us today. We're giving everyone a few minutes to log in. We're still about 2 minutes early, so we'll be with you all shortly, but thanks for joining early. Thank you all for joining us. We're still letting folks log in. If you do have any initial questions, feel free to put them in the Q&A box, and we'll have the speakers reviewing those for the Q&A session at the end. But right now, we're just letting folks log in and join us. Thank you all for joining us. We will get started in just a moment and let a few more people hop in. Okay, it looks like we are ready to get started. I will turn it over to ASH Executive Director, Laurent Hubert.
Thank you, Megan. So I want to welcome everyone to this webinar on tobacco industry interference in public health policies, which also marks the launch of the 2023 U.S. Tobacco Industry Interference Index. And this is the fourth such report that is being launched. I want to thank the panelists for joining us today. I want to thank the ASH staff also for organizing this webinar, and all of you who registered and joined this event today. And this is such an important topic. At ASH, we work a lot internationally. And one of the things we do is every few years, we attend the negotiations of the WHO Framework Convention on Tobacco Control, which is the Global Tobacco Treaty. And on the first day of negotiations, countries basically make statements on achievements on tobacco control and obstacles. And what's very interesting is one country after the other, they all say the same thing, that the biggest obstacle to implementation of tobacco control policies and protecting the health of their citizens is the tobacco industry. That really seems to be the common denominator, unfortunately, from one country to the other, whether it's in the Americas, Europe, Middle East, Asia, or Africa. It seems to be a common problem. So today we will hear from 5 excellent speakers who will present on various topics related to industry interference and also solutions and ways to address that industry interference. And then we will have a Q&A session where you will be able to ask questions to the panelists. So before I introduce the speakers, some practical and housekeeping items. You can, for questions, please use the icon at the bottom, the Q&A icon at the bottom of the screen. You can use it's better if you use that than if you use the chat box, because this way we will monitor the question and we can make sure that we get to all of your questions. And feel free to address them to a specific panelist. So I'll welcome the first speaker, who's Nichelle Gray, who's the Manager of Engagement of Special Programs here at ASH. And she will give an overview and highlights of the fourth U.S. Tobacco Industry Interference Index report. Nichelle, the floor is yours.
Thank you, Laurent, and thank you everyone for joining us today. for this important launch. I'm here to basically give you a very top-level overview of what you'll find in this year's U.S. Tobacco Industry Interference Index, because we have some fantastic speakers and I want to give them plenty of time to delve further into the tobacco industry interference issue. And as Laurent mentioned, we have this report. It will be posted online, and we can also drop the link in the chat box. So I encourage you all to read it after today's presentation. So let's start with a little bit of background. As Laurent mentioned, and as you've heard of, the WHO FCTC, or the Tobacco Treaty, that offers best practice recommendations for tobacco control. And one of the critical aspects of FCTC is Article 5.3. And this article states that there is a fundamental conflict between tobacco industry interest and public health policy. Because of that, STOP Partners recognized the gravity of this issue and came together to monitor and highlight global progress in dealing with tobacco industry interference. And many countries, including the US, contribute to this global index report, and it ranks compliance with Article 5.3. And ASH provides not only the data for that global index, but our report as well. And again, this is the 4th edition. So why is this important? Well, as we all know, tobacco remains the leading cause of disease and death in the US, and the tobacco industry consistently obstructs efforts to implement life-saving public health policies. It's part of their playbook, and reports like this are crucial in shedding light on their actions and providing recommendations for advocates and policymakers. So before I dive into what you'll find in the report, it's important to acknowledge a few limitations that are unique to the US in comparison to other countries that are reporting. So first, the US has signed but not yet ratified the FCTC, which means it's not bound by the obligations of the FCTC. Second is that US policy operates at the federal, state, and local levels. So this makes it really challenging to document interference comprehensively. So it's better to consider this report as a sample and not an exhaustive total. And then finally, some activities forbidden under the FCTC are actually constitutionally protected in the US, such as lobbying, which is restricted under FCTC. So now I'm just going to talk a little bit about what you'll find in the report, its score, and some of the key recommendations and takeaways. Within the report, we address 7 key indicators, and they align with Article 5.3 recommendations. So these indicators stem from a questionnaire that was developed by the Southeast Asian Tobacco Control Alliance. They include 20 questions that address the recommendations. And those indicators include level of industry participation in policy development, industry corporate social responsibility, benefits to the tobacco industry, forms of unnecessary interaction, transparency, conflicts of interest, and preventative measures. So actually, I would say the report itself covers data from April 2021 through March of this year. In each section, you'll find data examples and a scoring system, which assesses US compliance. And these scores range from 0 to 5, with 0 or 1 indicating a very low or no interference, and 5 representing high levels of interference. So you'll see in the example on the slide here that the US scored a 5 for indicator 6. This indicator specifically deals with conflicts of interest and assesses if the government prohibits contributions from the tobacco industry, political parties, candidates, or campaigns. And of course, unfortunately, these contributions aren't explicitly prohibited in the US, which can lead to indirect influence through political action committees. So during the 2021-2022 election cycle, The federal members of Congress received 1.4 million from the tobacco industry, and Senate also received just over 400,000. So this is just one example among many that you'll find in the report. So now we get into the score. And after evaluating all of the data and recommendations, we arrived at a score of 76 out of 100, which is no surprise, a very high level of interference in the US, because the US consistently struggles to keep the tobacco industry out of policy discussions. And you can find more comparisons with previous year's reports in this particular publication. Just wanted to note a few things about this score, which is first that this represents the raw data score for the US, and this is subject to change when the global report is released. The global report will apply a penalty to the US score due to the fact that the US is not a party to the FCTC. And additionally, the global report will reveal the US's global ranking, which is absent in our report, also because the global report has not yet been released. So before I conclude, sorry, I jumped ahead. Let me just pull up my presentation again. One second. Technical difficulties. Here we go. All right. Okay, so as I was saying before I conclude, I just wanted to touch on some of the recommendations that are outlined in the report and also some valuable tools that we have for advocates. So to combat the tobacco industry's influence, we offer several key recommendations, which are detailed in this report. And implementing even one of them would actually help to address the loopholes that the tobacco industry exploits, which hopefully would lead to stronger tobacco control policies, and they're all listed here. In addition to those recommendations, we also showcase the U.S. Tobacco Lobbyist and Lobbying Firm Tracker, which we launched in 2021, and we've since updated with 2023 data. We actually had an advocate reach out to us and tell us about their experience using this tool, which helped them uncover tobacco industry influence that would have otherwise been hidden. They were approached by a volunteer that had also been approached by a PR firm. And the advocate tried Googling this PR firm and this person to investigate whether or not they had any connection with the tobacco industry, was not able to find any information. They then used our tracker to look this person up, and they discovered that they worked for a lobbying firm that is employed by Altria. So one of these practical tools could be very useful in your work. So just in closing, to wrap this up quickly, I just want to make a request to everyone online today to please continue sharing this information and educating your fellow advocates and local legislators. We need your stories to inform our reports, and we also want to give legislators an opportunity to make informed decisions and resist the sway of big tobacco. So you'll find my contact information on the slide here, along with ways to stay up to date with us. And I thank you all for joining today, and I will pass it back to Laurent.
Thank you so much, Nisha. Thank you for bringing back also the tobacco industry lobbying and lobbyist and lobbying tracker, which is such a useful tool. And I'm sure that the audience will have more questions on this. And the recommendation that came up of educating and raising awareness about the FCTC, which I know is critical in the United States, where there's not as much awareness about the treaty. But that's even true in other countries, like in France. We've had situations where parliamentarians were not even aware that France had ratified that treaty and they had an obligation, that a legal obligation to the treaty. So something we need to keep on doing. The next presenter is Juliana Broad, an investigative reporter with the Center for Media Democracy. And this presentation, I'm really looking into this. It's an insight into industry front groups and tobacco entanglement with the American Legislative Exchange Council, which is an industry-funded bill that brought together lobbyists, state lawmakers who work behind closed doors to craft pro-corporate policies. So very clearly the poster child of tobacco industry interference type of example. So really looking forward to this presentation. Juliana, the floor is yours.
Great, thank you, Laurent and Michelle. Nichelle, can folks see my slides? Yes, okay, amazing. I'm just gonna hide this for a second and hide this. Okay, so thanks everyone to Action on Smoking and Health for the invitation and for the work that you all do. So my name is Juliana Broad. I'm with the Center for Media and Democracy, and I will be speaking a little bit, very quickly, about how the one way in which the tobacco industry buys access to our lawmakers. So these are some of the questions I want to address in the presentation. Who am I? What is the Center for Media and Democracy? What is the American Legislative Exchange Council? Some of you might be familiar with this organization, also called ALEC. How exactly does the tobacco industry access our lawmakers, and then where can you find more of our work? So again, my name is Juliana Broad. I'm an investigative reporter with the Center for Media and Democracy. I personally have a background in organized labor, as well as a master's degree in the history and philosophy of science and medicine. So I'm really looking forward, especially to the Truth Initiative's presentation on how corporate interests try to influence and capture scientific research and scientific communities. The Center for Media and Democracy, we are a nationally recognized watchdog group. We lead in-depth, award-winning investigations into the corruption that undermines our democracy, our environment, and our shared economic prosperity. How do we actually do that? Well, we file more than 1,000 Freedom of Information requests every year. We work with whistleblowers, and we examine a variety of public documents in order to expose the network of really right-wing billionaires and the industries and the organizations that they control, who are operating to benefit their own very narrow special interests. And one of the industries that's been a really long time player in these networks is the tobacco industry, which I'll be talking about a little bit more. So our work is regularly cited in a lot of national and local news outlets, and we also partner with other investigative reporters at GRIST and The Intercept and ProPublica to publish new reports and findings. But the real meat and potatoes of what we do at the Center for Media and Democracy is exposing the American Legislative Exchange Council, which is also called ALEC. So ALEC is the forum, it is the forum where corporations and state lawmakers come together in order to change laws in favor of their corporate interests. It is a member-based organization, and it's composed of state-level lawmakers, so senators and state representatives, who pay small annual membership fees. I think it's like $100 or $200 a year, as well as corporate members, and they pay thousands, tens of thousands of dollars in annual membership fees, as well as thousands more in order to sponsor ALEC events and get policy sessions of their choosing on those ALEC meeting agendas. So ALEC currently claims to have about 300 corporate and foundation members, and they also claim to have about 2,000 legislative members, although that might be a bit of an overstatement. And around 200 of those are in state leadership positions in their state houses. And it is worth saying that ALEC is intensely secretive about its membership list, and so this information that we have about their members is through our own reporting and other good government groups that have dug into this information. So you might ask, what's in it for a lawmaker to be a member of the American Legislative Exchange Council? Well, for small state level lawmakers, let's say you make $7,000 a year, which is what lawmakers do in Texas. ALEC provides a lot of support that lawmakers might not otherwise have access to. That includes legislative researchers, vetted hot button conservative ideas, and most significantly, an ALEC membership provides access to pre-written model bills on a variety of topics that lawmakers can take, edit a little bit if they want, add their state name into the bill, and bring back to their legislatures to introduce. And this aspect of how ALEC works is why we refer to it as a bill mill. It's inherently anti-democratic. So I pulled this from the ALEC website. This is just alec.org. They have their model policies up there. that you can go through. I pulled one that was an example model policy for cutting taxes on vapes. And you can see the task force that it came out of, the year that it was adopted by ALEC. And you can actually go through the text as well. Well, you will see it says insert state name here. So you can go through and look at model policies of interest and even compare if you see similar legislation in your own state house. So ALEC claims that it doesn't maintain any sort of database where its model legislation has been introduced, but different studies have found that ALEC has a success rate of about 1 in 5. So if you had 5 state lawmakers take this model bill on cutting taxes on vapes to their 5 state houses, chances are at least one of them would pass and become law. So we know what's in it for lawmakers to be members of ALEC. What's in it for corporate members? For them, it's pretty simple. Through a membership with ALEC, corporations and industry groups have direct access to hundreds or even thousands of state lawmakers who are really hungry to deliver on conservative priorities. And so this is why we refer to ALEC as a pay-to-play operation. Corporations are paying significant fees, tens of thousands of dollars and more, in order to effectively buy access to lawmakers at ALEC gatherings. They usually look like this. This is from Orlando in July at their 50th annual policy meeting. They schmooze at fancy hotels, corporate representatives and lawmakers hanging out in the same fancy hotels and voting on equals on which pieces of model legislation they really want to adopt as an organization and then give to their state lawmakers. So just a little bit more about how ALEC works before we get into Big Tobacco's role. So ALEC has a number of task forces and policy centers. Again, this is just screenshots from ALEC's website. Each lawmaker who's a member can be on up to 2 of these task forces, and each task force has a public sector chair and a private sector chair. So for example, the Commerce, Insurance, and Economic Development Task Force, the public sector chair could be a state senator from Arkansas, and the private sector could be a UPS representative because they're an ALEC member. And so these task forces pump out model policies on eroding local democracy through preemption bills, eviscerating environmental regulations, undermining organized labor, and deregulating toxic industries such as fossil fuels and tobacco. And in addition to their model legislation, ALEC has policy reports, they file amicus briefs, they write op-eds, and so on. They in general have a very slick public presence that completely obfuscates their incredibly destructive agenda. So ALEC has been around since 1973. They have just been celebrating their 50th anniversary. And they've weathered a lot of storms. For example, a coalition campaign led by progressive groups in around 2011 resulted over a couple of years in more than 100 corporate members of ALEC leaving due to public pressure. And this wave of activism came out of our ALEC Exposed project that we launched in 2011. That being said, ALEC is still enormously influential. They just yesterday were celebrating their 50th anniversary gala at the National Portrait Gallery in Washington, D.C. And one of the reasons it remains incredibly influential is because its work is subsidized by deep-pocketed corporations such as Altria and other tobacco giants. So where does the tobacco industry enter the frame with ALEC? ALEC has for decades worked hand in hand with big tobacco companies who have been for decades feeding lawmakers industry propaganda about secondhand smoke. It's not that bad for you. And the industry brings loads of economic benefits. They oppose state and federal regulation of tobacco sales and smoking in public places. This is a screenshot from UCSF's amazing document library of industry documents that I think the Truth Initiative had a hand in bringing up, so hats off. This is a document from R.J. Reynolds from the late 1980s, strategic plan in which they call out ALEC as being a really good ally in terms of creating an atmosphere of tolerance and fairness in the public's attitudes towards smoking and smokers. And not much has changed since the late 1980s. So Altria, which is a name here presumably everyone knows, the parent company of Philip Morris, the tobacco giant, Altria has been a really long-time funder of ALEC for decades, and they hold significant institutional power within ALEC to this day. So as I said yesterday, in Washington, D.C., ALEC was celebrating their 50th anniversary. Altria was one of the top funders. This is a screenshot from the website, but last night we acquired one of the actual printed documents that had the tier sponsorship level, and Altria was the diamond level sponsor. So they're really up there. Altria holds loads of roles within the organization. Daniel Smith, of Altria Client Services, which is the lobbying arm, he served on what's effectively the private sector board of directors since at least 2011, and others from Altria have served before him. There's a lot of examples I could dig into, and Altria is often chairman or vice chairman level sponsors at different ALEC conferences. So at the Center for Media and Democracy, we've really been at this for well over 10 years in terms of working at the forefront of exposing the deep ties between tobacco giants and ALEC. We first outed ALEC's pay-to-play operations in 2011 after we received and published more than 800 model bills, which we got from a whistleblower. This was before ALEC would post them online. So our most recent investigation over here found that two of Altria's top lobbyists made presentations at ALEC's 50th annual meeting just this past July, a couple months ago. And in that presentation, they urged state lawmakers to deregulate the tobacco industry. So Mark King, who's one of Altria's top lobbyists, gave an 8-minute presentation right in the middle of ALEC's tax and fiscal policy task force meeting, kind of different presentations, and then everything was paused and lobbyists came in, gave an 8-minute presentation to the lawmakers present. And in his presentation, he was really trying to make the case for deregulating, in particular, flavored tobacco products and vapes. So these are just some examples of what he was saying. You know, prohibitionist policies, they create so many unintended consequences. You know, your constituents want alternatives to cigarettes, right? And they want another product that they can use to transition away from smoking. What we know from our reporting is that at least 19 state lawmakers were present and listening to this presentation at this task force meeting. And at least half a dozen of those state lawmakers serve on their state's health policy committees. Our investigation also highlighted the type of messaging that tobacco companies have been using for the last couple of years in terms of claiming that they're part of the solution and part of the movement towards harm reduction. So this is a screenshot from Altria's website. You can see they say they are moving from being a tobacco company to a tobacco harm reduction company. Mark King said something very similar, that, you know, harm reduction works in other industries and it's the same with tobacco as well. Obviously, that messaging sounds totally ridiculous to the well-informed people attending this webinar, but this is the rhetoric that our state level lawmakers are hearing in these closed door meetings with lobbyists. And it's obviously a huge problem. So I know I'm kind of running over time. So on that really dreary note, I'll just share some resources. ALECexposed.org. This is our original database that we launched in 2011. Everything that you could want to know about ALEC is on there. SourceWatch is our kind of wiki for different corporate front groups. Exposed.cmd.org. This is where you'll find our original reporting, including the report that I was mentioning. And then if you want to sign up for our newsletter, tinyurl.com/CMD emails. And then we also had a great piece in the American Prospect that ran yesterday. That's an excellent overview of ALEC. So I encourage folks to check that out as well. But I know I'm over time and I'm looking forward to the other presentations and the other panelists. So thank you very much.
Thank you, Juliana, for this excellent presentation. And I have a question, but we'll get to that when we get to the Q&A session. The next presentation will be a co-presentation done by a few people from Oklahoma. So first, Julie Bisbee, Executive Director of Tobacco Settlement Endowment Trust, will start the presentation, and they will cover between them, a few of them between Julie, Chase Harvick, and Tyler Klassen will provide example of local tobacco industry interference in Oklahoma and explain how to use the corrective statements for media advocacy. And you'll hear more about all of that during the presentation. Julie, the floor is yours, and I'll let you introduce the other two speakers.
Excellent. Thank you. And thank you for this opportunity to speak with you today. We are in Oklahoma, so we are, I believe, the nation's only constitutionally protected trust that is taking payments from the Master Settlement Agreement and using the majority of that, its earnings, for programs to improve health. So that's a little background on us. And if you're not familiar, 46 states sued Big Tobacco in the 90s, and that lawsuit ended with the Master Settlement Agreement, which had reforms, but also payments to states based on market share of cigarettes. And so one of the things that we want to talk to you about today is things that you can do at the local level, especially if you are here in the United States, around the corrective statements that will be coming out. In Oklahoma, we know that in any given year, there are 10 to 12 registered lobbyists. So if you're not using that tracker, that tool that ASH has, I would encourage you to do so. Often what we see is that lobbyists will have a health insurance company and also a tobacco company as part of their portfolio. So, lobbying is a job, it's an art, and it's just important to know the interests that are being represented. We also know over time through research that Doug Matheny and others have done that in industry documents, they talk about how friendly Oklahoma is to tobacco policy. We have had a deregulation bill run in our state, and we've also, we're one of the few states that prohibit cities and municipalities from making rules and laws around smoking and the sale of tobacco stronger than state law. So all of that to tee up is, as an agency, we saw the corrective statements, which are coming out of the lawsuit in 2006, Judge Kessler's ruling, as an opportunity to aid and advance the awareness of the public's knowing about industry influence. We wanted the public to know more about this because there is also research that shows when people know that the tobacco industry has a hand in writing laws, they are more likely to contemplate a quit attempt, which is something that we also fund, tobacco cessation. And the public generally does not support that kind of industry influence. And I think that that's an important point to make with lawmakers when you're having those conversations about what is good policy for our citizens, what is good policy for health. And a little bit later, I'll throw the link to the paper into the chat so that you can all see that. But right now, I want to turn it over to our team to talk about how we use the corrective statements, especially those that are showing up at tobacco retailers, as an opportunity to, again, advance that knowledge. So I will introduce Chase Havrick. He is a campaign manager for Tobacco Stops With Me, which is one of the programs that TSET runs, and also works on the Oklahoma Tobacco Helpline. Prior to that, he's worked in communications. He's going to talk about our approach. And then Tyler Klassen is with our media firm, VI Marketing and Branding. And he has worked with us in the advertising industry for about 5 years. He specializes in brand management and has worked on our team for about 3 years with this campaign.
Thanks, Julie. And yeah, you mentioned the 2006 case. That did find that tobacco companies deliberately deceived the public about smoking and that they had marketed to children as replacement smokers for years. And we'll go more into that decision in a bit. But in 2017, after more than a decade of appeals, the companies were forced to come clean and admit the truth in a series of court-ordered corrective statements released through national print and TV media and online. Now in 2013, as the last part of that agreement, these companies are forced to use part of their marketing space in more than 200,000 point of sale locations to post corrective statements. And Tyler, let's go ahead and go to the next slide, please. I'll let you guys look over the specific findings from that case, but I just want to point out that RICO, R-I-C-O there at the top, that stands for Racketeer Influenced and Corrupt Organizations. And it was originally made law in the 70s to break up organized crime in the US. I want to read this quote from Judge Gladys Kessler, who wrote the decision in the case. She said that tobacco companies have marketed and sold their lethal products with zeal, with deception, with a single-minded focus on their financial success and without regard for the human tragedy or social cost that success exacted, and that they abuse the legal system to achieve their goal to make money with little, if any, regard for individual illness and suffering, soaring health costs, or the integrity of the legal system. I thought that was just a perfect encapsulation of what they were up to. And Tyler, let's go ahead and go to the next slide. These are some examples of the point of sale corrective statements that the tobacco companies have now posted. You'll see these at convenience stores and other tobacco retail stores. It's expected to provide a high-profile opportunity to raise awareness of the RICO verdict and tobacco industry interference. I just think it's interesting to look at the gentle kind of blue-green colors and a splash of purple. If you'll notice, the little asterisk looks like it has 2 cigarettes in its little purple parts, or the tip of the cigarette there. The timeline for the point of sale corrective statements, the posting period just ended. We are now in the implementation period, and that goes from October 1st to June 30th. Now, this is June 30th, 2025. This is when the signs must be displayed in the store. There's also a rotation period from July 1st, 24 to September 30th, 24, when the retailers will have to swap out the creative signs. We'll have to put new signs up. And Tyler, we'll go ahead and go to the next slide, please. Julie mentioned Tobacco Stops With Me. It is a statewide campaign. It's funded through TSET. We want to provide an efficient, emotional, and just a highly recognizable tobacco-free message for Oklahomans to rally around. And we want to educate the public about the negative effects and impact of tobacco. And our goal overall is to prevent and reduce tobacco use, improve health and quality of life of everyone in the state. So TSET strategically timed the release of this new point of sale corrective statements campaign around the rollout of the signs in order to leverage and amplify them. Our main goals are to inform and educate Oklahomans on this historic decision and remind them that the fight is not over, that big tobacco continues to find slick new ways to put profits over people. Next slide, Tyler. To do this, we use creative messaging from our Tobacco Stops With Me brand that addresses the industry's deception. Our populations of focus for the campaign, our audience is 35 and older, college educated with a household income higher than $50,000 who are civically engaged. And we'll go to the next slide, Tyler. The call to action for the campaign invites audiences to fight back against the industry's attempt to addict a new generation of Oklahomans. And we like to direct people over to our website, stopswithme.com. We'll throw some links down in the chat there. Now I'm going to turn it over to Tyler Clausen, who's the Senior Marketing Strategist at VI Marketing and Branding. And Tyler's going to tell you about the specific tactics we're deploying as part of the campaign.
Thanks, Chase. I just want to quickly give an overview of this campaign that Chase beautifully introed here. So in this corrective statements campaign that is being messaged out by Tobacco Stops With Me, here are a few of the tactics that we're utilizing. So we have, of course, garnered some earned media through press releases and website promotion. We're providing partners with talking points, and we have a few digital and social paid tactics that, like Julie said, are funded by that master settlement agreement and allow us to promote these messages. So these messages come in a variety of forms here. We have created with TSET unique ways to display these corrective statements. So ideally, folks throughout Oklahoma and the United States are seeing these corrective statements every day at their local convenience store, gas station. And we want to continue to build on that messaging that's happening, create awareness about why are those messages posted. We don't want anybody to miss them. And then we are also taking that opportunity to take those messages, though truthful and correct, may not be sharing the full extent of the truth. So as you can see, our creative is claiming here that we're going to take those messages and share the whole truth. So we've marked out words, we've added words that gives a more blunt, raw truth behind the things that these tobacco companies are forced to say. All of this initiative is led firstly by our print advertisements. These are running statewide in Oklahoma. And again, some more examples of us taking those corrective statements that folks are seeing every day and sharing even more education and awareness. The idea behind this is to help people understand why they're posted, create some more anger and frustration for why these things happen. And of course, this campaign has done an excellent job in the past and so far in creating more advocates to help people join in on our campaign and our goals. So the idea with sharing these with you all is that you would be empowered to do similar messaging in your local program or organization. And here in a second, I'll show you how we've made resources available for you to do so fairly easily. On tobaccostopswithme.com, we have created a landing page, and this landing page shares all kinds of information similar to what Julie and Chase just provided about the corrective statements, the origins of it, and why we're messaging on it. And then we also are housing all of these campaign resources that give that extra truth to the corrective statements. We have created a large number of videos that, as you can see, outline what the companies are legally forced to say, and then give sort of a more in-depth translation with some additional information for our audiences to understand more about the statements. And on our website, we've also provided resources. In addition to talking points to partners, we want average Oklahomans and folks throughout the country to be able to grab some of these resources and share on their personal platforms. So we provide images and copy for people to become advocates on their social channels. So for us personally, we've run a campaign similar to this in the past, and we're running one now. We launched this campaign just about 10 days ago on September 25th, and it'll run for several more weeks. So far, I pulled some numbers of the performance of this campaign just in the first week so I could share with you all and encourage you to try similar approaches in your organizations or programs. We're experiencing in the first week over 500,000 impressions. Our video tactics are experiencing 63% view rates, which basically means that people are engaged with that video and staying around to the end. Our promoted social posts are garnering all kinds of engagements and comments, and people are engaging in discussion, visiting our site to learn more, to the tune of 52% engaged users. And these are not per se rare numbers, but they're certainly not common for digital advertising. And so already we're seeing that this campaign is doing a really great job of bringing people in, engaging them, helping them understand why these corrective statements are being posted, and providing some additional teachings on this. So we want to encourage you to do the same thing in your program. We've partnered with the CDC to make all of our creative assets available to anyone that wants them for free through the CDC's Media Campaign Resource Center, the MCRC. All of our resources and creative are available there, and we've removed our logos and tags that you can have those for free, put your own logo on them, and distribute them however you are able. We also have all the campaign resources on stopswithme.com that are branded with ours, and they allow for easy distribution if you want to just kind of spread and partner with us in spreading the message. So we really hope that you find agree with us that you find this in a useful way to distribute this message and create awareness about the horrible things that the tobacco industry is doing. We have worked really hard to make these easily accessible for you, and we encourage you to do that as well as you can. Please reach out to us if you have any questions about how to do this or the best approach to doing it. Like I've said, we've experienced quite a bit of success and want to encourage others to do the same. Thank you so much.
Thank you, Julie, Chase, and Tyler. And I have a few questions, but wait for the Q&A in order not to steal any time from the last speaker, who's Padmini Kucharlapati, who's a research associate at the Truth Initiative with the Schroeder Institute. And her presentation will address industry intrusion and interference in scientific spaces, academia, peer-reviewed publications, type of work. And she will provide practical approaches to prevent that type of interference. So Padmini, the floor is yours.
Thank you, Laurent. Can you all see my screen? I just want to make sure before I begin.
Yes.
Before I begin, I want to thank everyone at ASH for the opportunity for us to share our work today. I'm Padmini Kucharlapati. I'm a research associate at Schroeder Institute, which is the research arm of Truth Initiative. And for those of you who might not be familiar with our organization, Truth Initiative is the largest nonprofit in the US, committed to achieving a culture where young people reject smoking, vaping, and nicotine. And we do that through 4 arms that focus on creating public education campaigns aimed at youth and young adults. We conduct rigorous tobacco control research. We foster activism and engage with young people at a community level. And we're constantly innovating cessation treatments. You all might be familiar with this already, but there is some good and bad news. We are seeing historic lows in cigarette smoking prevalence among young people, but we're also seeing a rise in e-cigarette use. We're seeing a 14% among high school users, high schoolers, and 3% of middle schoolers who are using e-cigarettes as of 2022. And we did not get here by accident, as some of the speakers before me have Given some background, we know that this is happening because the tobacco industry is constantly expanding their product line, flooding the market with new products, attracting youth and young adults, and targeting their marketing to the customer base who might not have used cigarettes before. They are reshaping their image among influential audience and the general public, and they continue to lobby and throw money around to influence policy. There's a lot of evidence that even speakers before me have shared on all of these strategies being implemented by the industry, but I want to specifically focus on how they're changing the narrative and the work that we have been doing to sort of mitigate that. To shift the narrative, they have been redirecting some of their advertising spend on rehabbing their image. We saw paid advertorials in the New York Times, the Wall Street Journal, where they're positioning themselves as a harm reduction company, like how Juliana shared an example. So they're sort of co-opting the concept of science and claiming that they support the public health strategy of harm reduction. They're doing this not just in print and digital media, but they're coming directly at the scientific community as well. These are some examples where folks who received funding from the tobacco industry published something in the American Journal of Public Health. Juul bought out a special issue in the American Journal of Health Behavior, and they also presented some of their scientific studies at Society for Research on Nicotine and Tobacco, or SRNT, in 2021. Since then, SRNT has revised their policies to ban tobacco industry employees, but we continue to see their participation in conferences, and they continue to publish in journals. Some journal publications also come from grants. PMI, or Philip Morris International, as you might know, is a leading tobacco company internationally, and they fund the Foundation for a Smoke-Free World, or FSFW. The FSFW has a grants program, and they influence the field via their journal publications. So at Truth Initiative, we looked at the FSFW grants from 2017 when the foundation was established, from 2017 to 2022, and we saw that 61 grants were given to 42 US-based organizations that led to 30 journal publications. So at Truth, we're doing a more in-depth analysis of these grants, the publications, the areas of focus of these papers, and the impact that these papers have. So we hope to share a very detailed report very soon. But at first glance, we can see that this is evidence for how existing conflict of interest policies at journals are not keeping the industry-funded folks out of the scientific spaces, and we need to work towards changing that. Which brings me to why the Tobacco Science Integrity Steering Committee came into existence. This committee was started, led, and is supported by Truth Initiative, where it's expanded toward a diverse group of researchers, policy analysts, practitioners, and program staff from across the US. And we've all come together to protect the scientific community, and we want to do that by educating scientists, public health professionals on industry actions, and especially educating the newer generation of researchers. And we want to initiate an open dialogue to change policies and practices in key scientific organizations to prevent conflicts of interest. And we want to counter and expose the efforts of the industry that they've been taking to undermine scientific integrity. And now I want to focus specifically on actions and steps that we've been taking to change policies and practices and exposing their efforts. So to advocate for improving conflict of interest policies and to inform the concerned organizations, it's important to look at the existing policies and see how it can be improved and what's missing. So we looked at the conflict of interest policies of major scientific journals where we publish our tobacco control research. And we saw that there are some gaps that could be addressed. For example, even if the journal mentions tobacco industry employees, the definition needs to be broadened to make sure that we leave no room for loopholes. So we need to explicitly exclude everyone, including consultants who are funded by the tobacco industry. And we need to remove any exceptions to how they participate in our scientific spaces. So we need to exclude everyone from who are funded by the industry from publishing papers, participating in conferences, and also reviewing papers. And Most importantly, we need to make sure that these instructions or conflict of interest policies are easy to find and are more accessible to everyone. At Truth and the steering committee together, we put together a model policy that journals can adopt. I can share that with anyone who's interested. Now that we understand how policies can be improved, we wanted to communicate with the key organizations that are concerned and bring to their attention how their respective policies can be strengthened. So we worked with leadership at the American Public Health Association, Society for Research on Nicotine and Tobacco, SRNT, and Society of Behavioral Medicine, SBM. As you might all be familiar, these are highly recognized academic conferences where public health professionals and tobacco control researchers share their work. So it's critical that we protect scientific integrity in these spaces where we're all participating and exchanging knowledge. So with APHA specifically, we wrote letters to them and we urged them to adopt a comprehensive policy and provide a more clear definition of the tobacco industry. They did take steps forward to formalize a conflict of interest policy for abstract submission and advertising at APHA. With SRNT, we wrote a letter to their leadership and we first applauded them for some of the steps that they've taken in 2021, and we encouraged them to move forward in that direction and exclude consultants who are funded by tobacco industry. They acknowledged our recommendation and they're working to collect data to determine if they can determine membership eligibility for industry consultants in the future. And lastly, with Society of Behavioral Medicine, we sent them a letter urging them to restrict those who are funded by the industry and industry employees to prevent them from attending their annual conference. The SBM leadership was also responsive to us. They met separately as a small group to discuss this issue, and we are continuing to be in touch with them, and we look forward to see how they change their conflict of interest policy. Here, I want to emphasize how these are membership-driven organizations. So we had a lot of experts and professionals who signed on to the letters that we sent to the leadership. So it's important to remember that members can and should raise these concerns and demand action from these organizations. So in addition to communicating with organizations in the scientific space, we also think it's important to communicate with fellow researchers, and we should contribute to the academic conversation. Colleagues at Truth Initiative published on pushing back against the industry interference in science and calling for stricter conflict of interest policies. Other researchers have also done similar work, and they called out the FSFW's grants. As I mentioned before, Truth Initiative is developing a report, and we hope to release that soon. Just closing it off with things that we all could do to promote tobacco science integrity. We should speak out and raise awareness on the industry's role in scientific space. Be vigilant of their presence in conferences or their contributions to research in journals that we all read. The Truth Initiative's official website has a landing page dedicated specifically to promoting scientific integrity, and we have a ton of resources that I also linked in the slides that will be shared with you. So we encourage everyone to familiarize with these resources, learn more about this issue, and share it with your colleagues. This is my email. My colleague, Jory Briggs, couldn't be here because of jury duty, but you can reach out to both of us if you have any questions.
Thank you so much, Padmini. So we will go straight into the Q&A. Feel free to type them in the Q&A using the Q&A icon at the bottom and direct them to a specific panelist. And I have a few questions that some have come that way and some of them were sent directly to me. So the very first question that I have is on the it's for Jody, for Julian, I mean, and it's on ALEC, and whether there's any opportunity to try to remove the tobacco industry from ALEC membership. For example, someone pointed out that the UN Global Compact, which is claims to be the world's largest corporate sustainable initiative through the UN system, removed tobacco industry from its membership because it they felt that it violated the right to health. Is there any such thing happening with ALEC or any opportunity to do that?
Yes, there is. So first I'll say that ALEC is problematic, not only because of the industry groups that use it to access our legislators, but in and of itself is an anti-democratic way of establishing model legislation. But that aside, so yesterday was the 50th, ALEC was celebrating its 50th anniversary. And in response, a number of good government groups and progressive groups, including Greenpeace and Common Cause, a bunch of unions have launched a new petition that individuals and organizations can sign to demand that corporations leave ALEC and no longer subsidize its activities. So that's kind of the main route that people are focusing on right now. I think the petition, it was supposed to launch today. I can find a link to make sure that it has, but we can also circulate that to panelists after if organizations do want to sign on. It's not tobacco industry specific, but if people have the idea of starting a campaign to get Altria, which, as I said, is one of the top funders, of getting a campaign for them specifically, that would be a good thing.
There are a lot of precedents about specifically excluding the tobacco companies, and we have a number of those through UN processes. So those could be an interesting precedent. The next question is for the Oklahoma team. Any partnerships with tribal nations in Oklahoma regarding the corrective statements for the smoke-free shops, convenience stores, and gas stations? I don't know if Tyler, Chase.
Julie, do you want to?
Sure, that's a great question because we want to partner with our tribes on any of these endeavors. In the past, we have had things that are specifically sort of branded with more of a tribal feel. To my knowledge, we do not have that for this particular campaign, but there are a lot of resources out there. And thanks for the question, Lou. It's good to see your name out there in the work still.
Do anyone else from Oklahoma want to add to this? So if I understand correctly, you're trying to reach out and to work out more with the tribal nations. Is that? But it's not something that's already 100%.
Correct. So this campaign does not have branding that would be specific to tribes. So what we've done in the past is have things that more incorporate sort of native artwork or colors on some of our other things for the Oklahoma Tobacco Helpline. This campaign's design elements are very much what you see with the red and the black. But that's a great question, and those resources are available to all. So I would encourage anyone to click on that CDC website and figure out how to get those things to your groups.
Right. And one quick question, I don't know if it was that, I think Tyler maybe is in a better position to, he had mentioned the much of the work was printed materials, but that you stated that a lot of the materials that you've created are available for free through the CDC site. And is this, we want to make sure that we can help disseminate this, given that it can be used, I suspect, not only in the United States, but even outside of the United States, could be interesting information, because often I hear people, even outside of the US, referencing to some of the legal cases and the outcome of the legal cases. So those materials are available.
Yes, thanks for bringing that up. Those are available for free. And again, they're untagged, unbranded through CDC's Media Campaign Resource Center. We have some tagged versions on our site, and I believe Megan has just shared those out in the chat to everybody. So please check those out. We've worked really hard to make those incredibly easy to use in your own program. And some people I know have paid media dollars to do such things, and some others do it through earned media, but we've created resources for all of that. So utilize those, and the CDC has made it easy through their center as well. And we encourage you to reach out with questions on how to disseminate that information most effectively in your area.
And I've noticed we have a number of participants who speak other languages, and I know the CDC sometimes has translated things. Do you have it are some of those being translated into Spanish, for example? We noticed a number of people from Latin America on the webinar today.
Yes, thanks for asking. The resources that are currently available, like I said, we just launched about 10 days ago, are English at the moment, but we'll continue working to provide more versions for as many people as possible.
Wonderful, wonderful. Padmini, I have a question for you here. It's in regards to the implementation of conflict of interest policies. And what's the biggest challenges you've encountered from the work you've done and the work you've done with Truth here on this, on the implementation of these conflict of interest policies as recommended by the Tobacco Science Integrity Steering Committee? What are the biggest challenges basically that you find?
I think the biggest challenge is to stay patient. It is an iterative process. We all come together to strategize on how best we can, communicate some improvements and make recommendations. And I think we cannot achieve everything at once. So it's a process. So I would say that might have been the most challenging, to be patient, pick our battles, and continue the conversation. So some of these letters that I shared, some of this was some back and forth. It wasn't overnight that it happened. So I think being patient and strategizing in the right way. Lauren, you're on mute.
Sorry. Thank you. Thank you for pointing that out. I mean, I'm really conscious of time. We have only 2 more minutes, so I'm only going to go to ask one more question here. In the state of Missouri, they have a 17-cent PAX tax rate, and only 7.7% of the tobacco settlement funds goes to tobacco and help. What resources are available to inform and impact legislatures to take action? I wonder if any of the speakers, including Nichelle, if you have any recommendations in that area.
Oh, I think I will let maybe Julie, I saw you nodding, so I'll let you go ahead and answer that one.
Well, as a border state to Missouri, definitely your tax rate is attractive for people to continue to travel to Missouri to purchase cigarettes. And you also have the health environment that shows that, unfortunately. I think what has been really helpful for Oklahoma, we've had the endowment in place since 2000, is that it was created by voters. Legislation was run to put it on the ballot, and voters approved that and affirmed it again in 2020. And so having a strong coalition of local advocates and others has been useful. I know in Missouri, you had a ballot initiative a while back that was the tobacco industry also participated in. And so it is very, very challenging. But I think there's a lot of information out there about tax rate, spending, and the health outcomes that you see when you invest in prevention and cessation. And also it's a loss of revenue. I mean, I know southern states are always looking for money, and increasing revenue certainly gives you more resources to do different things.
Good point. I wish, unfortunately, we came to the hour. There's a lot of other wonderful questions, but unfortunately we don't have the time to answer them all. But I want to again thank all of the panelists for those wonderful presentations. And I encourage you also to join, read the report, the 2023 index, Tobacco Industry Interference Index. And also if you reach out to Nichelle, if you want to engage in any of those processes or the lobbying tracker as things move forward. Also stay tuned for one of our next webinars and register today to save your spot, as the US FDA will announce its ruling on menthol, when it was fully implemented. When that happens, there will immediately be a webinar. And in some of those, recently we've had an overflow. So we encourage you to pre-register as soon as possible. But again, thank you to all the panelists, thank to all of the attendees, and thank you to the staff for organizing this event today. Have a wonderful rest of